Hi everyone and welcome to today's video. I'm Mary Felling, physical therapist. Today I'm going to be showing you a correction for your hip. In my practice, I saw a lot of people with back pain and hip pain, and when I evaluated them, I noticed there was a lot of differences one side to the other. So one side of the hip might be elevated compared to the other. One side might have been rotated forward or back compared to the other. And once I did a simple hip correction, the hips would level out and the patients report they'd have less back pain. So let's get started. I'm going to have everybody get on the floor. You can do this on the bed, on a couch, doesn't matter. You'll still be effective no matter what your surface is. If you need a minute to get into on the floor at a couch, go ahead and pause this video and come back. For the rest of us, this is what this correction looks like. So you're going to lie down on a flat surface. And like I said, bed or couch is fine. And you're going to bend your knees and feet are going to be flat on the floor. So a nice way to see if you do have a change in the balance of your pelvis, if you don't have a physical therapist right there to examine you, is take your feet and put the heels of your feet together. So not one in front of the other or back behind. Make sure they're right next to each other. And then look down at your knees. And is one knee longer or higher than the other? That's a good indication you probably have a hip change. So the correction we're going to do today is called an anterior rotation correction. Over 90% and probably 95% of the patients that I saw were rotated forward on the right. And in my own studies with the John Barnes myofascial release program, it's also taught in that program or that particular approach that a large portion, if not 99% of rotations here in the United States or in the Northern Hemisphere are rotations on the right. Go to the lower hemisphere, usually rotations are more forward and anterior on the left. All right, so you're going to take your feet, you're going to take one leg, you're going to place your foot on top of the opposite thigh. And in this position, you're going to be pressing your foot, and you always start on the right side, right foot down into the left thigh. The left thigh is attempting to pull back against the foot, and so you've got this isometric contraction going. So all I'm doing, I'm squeezing my right glutes to push my foot in. My left knee is attempting to come back, but there's no movement, and you hold this for 10 seconds. And your mind is just consistently thinking of tightening those glutes on the right. And then at the end of 10 seconds, you switch. Bring your other foot up, place it on the top of the thigh. So I'm not like this, my knee's not over like that, or I'm not like that. The foot is on the top of the thigh. And then again, the same thing. I'm going to press my left foot this time down into my right thigh. My right leg is trying to come back, and all I'm thinking about is tightening, clenching that left glute to help push down. It's called a muscle energy technique. We're using the energy, the contraction in the muscle to help pull on the bone to get it corrected into its natural position. It's a 10-second count. And then when you're done, you're going to go back to the right. And do it again. Just push your foot into the left thigh. Left thigh is trying to come up. And all you think about is squeezing that right cheek. It's a 10-second hold again. And at the end, you bring your foot down. And then you'll want to have nearby a ball. So I've got a volleyball ball. You could use a soccer ball. If you don't have a ball this size, you can take a very firm cushion from the couch or maybe a decorative pillow and put it between your knees. I wouldn't use just a regular pillow from the bed because it doesn't offer enough resistance. Once you get the ball between your knees or the couch cushion, you squeeze as hard as you can and hold for a count of 10, or it can be 2 deep breaths in. You're really squeezing the muscles on the inside of your thighs. And relax. And you do that 2 more times. So you're going to do a total of 3 squeezes. Last one. 2 breaths in and out. And relax. When you do that, you might hear a click, or you might feel kind of like a pull in your groin. That's okay. That's good. It means you've got that. You've corrected the symphysis, the pubic symphysis, and that's what this correction is doing. Because when you correct there, then that in turn corrects the hip bones that the pubic symphysis is attached to. So do this once in the morning before you get out of your bed, and then you'll do it again at night after you're back in bed. When you notice, or if you notice that after you do this technique and you're walking around, the first time you do it, practice the technique and get up and see if you feel a difference. If you feel good, that means then also during the day, if your hip or your back is bothering you, stop if you can, lie down on any piece of furniture, the floor, whatever, and do this correction technique. Get back up and see if it sets you back up for improved sensation in your low back and your hip for the rest of the day. All right, that's it for today. Hope you enjoyed this technique. And if you have any questions, you can always email me at bodyschoolfm@gmail.com. Thanks for watching, and I'll see you in our next video.